What are alternatives to CPAP for sleep apnea in Ehlers-Danlos syndrome? If you or someone you know has familial Ehlers-Danlos syndrome and struggles with sleep apnea, you might be wondering about alternatives to continuous positive airway pressure therapy. Let's look at some options that could help manage sleep apnea effectively. Ehlers-Danlos syndrome is a group of conditions that affect connective tissues. This can lead to structural issues in the airway, making obstructive sleep apnea more likely. While continuous positive airway pressure is the standard treatment, it may not always be the best fit for everyone, especially those with Ehlers-Danlos syndrome. One alternative is positional therapy. This method involves changing your sleeping position to avoid lying on your back, which can worsen airway collapse. By sleeping on your side, you may find it easier to breathe at night. This approach is non-invasive and can be a simple adjustment to improve your sleep quality. Another option is oral appliances. These are custom-fitted devices that help reposition the jaw and tongue to keep the airway open during sleep. Many people find these less intrusive than continuous positive airway pressure. However, their effectiveness can vary based on the severity of the airway obstruction and individual anatomy. For some, surgical interventions might be necessary. If there are significant structural problems contributing to airway blockage, surgery could be a solution. Procedures may include correcting nasal or throat issues. However, surgery carries risks, especially for those with Ehlers-Danlos syndrome due to fragile tissues. A thorough evaluation by a specialist is essential before considering this option. If daytime sleepiness continues despite treatment, medications may help. Wake-promoting medications can improve alertness but do not address the underlying sleep apnea. These can be useful for managing symptoms related to disrupted sleep. Adaptive therapies can also play a role. Using humidifiers with continuous positive airway pressure or trying different positive airway pressure devices like bilevel positive airway pressure can improve comfort. Additionally, managing other health conditions and practicing good sleep hygiene can support better sleep outcomes. Finally, close monitoring and personalized treatment plans are vital. Because Ehlers-Danlos syndrome can lead to complex airway issues, working with a team of healthcare providers, including sleep specialists and ear, nose, and throat doctors, is important. Regular follow-ups can ensure that the chosen treatment remains effective and comfortable. In summary, while continuous positive airway pressure is commonly used, there are several alternatives for those with familial Ehlers-Danlos syndrome. From positional therapy and oral appliances to surgical options and medications, a tailored approach can help improve sleep quality. Always consult with healthcare professionals to find the best treatment plan for your unique needs.